Good morning, everybody. Good to see folks and their videos. My name is Stephanie Charrington. I am the Executive Director of the backbone of Eastside Pathways. I want to, if you haven't already, I want to invite everybody to please share your video. It's wonderful to be able to connect with people face to face. Even though it is virtually, it does help, especially as we're in shelter in place. It helps make a greater connection. And quite honestly, that's what this work is about making these connections and taking action so we can help those most in need. I want to also just invite you, if you haven't already been doing this, I see a few folks are already doing this because they know where I'm going to go with it. Please include your name, the community or organization with which you're associated, and your email address in the chat box, if you can. I'll go over where the chat box is in just a second. Before I do that, I want to introduce our team here at the backbone with Eastside Pathways. So Sandy Nathan, Sandy, give us a wave, is going to be our community impact manager, our facilitator for today. Kalika normally has been facilitating these calls. Kalika Curry is one of our other impact managers, and she's not available today. So Sandy, who has actually been facilitating a number of other groups, not this one, but different ones, is going to be helping us out today. I want to also introduce Joe Trotty, who is our communications manager. Good wave, Joe. Also Peyton Richardson, who is our data officer. And Vicki Yu, who is our business and operations manager, running things behind the scenes. So for those that are not familiar with Eastside Pathways, first and foremost, Eastside Pathways is a community partnership made up of individuals, organizations, nonprofits, public, private, all coming together to support kids from cradle to career. The idea is we're working primarily to change the way we work together so that we get better outcomes for children birth to 26 is what we define as cradle to career. In order for that partnership to kind of organize, we're the staff of that partnership. And our role is to convene and facilitate. During this crisis time period, we as the backbone have decided that we're going to be pulling together these drop-in series of meetings for multiple stakeholders. Anybody can participate so that we can begin to make connections as well as start to take action to see results. So before I get into more of the meeting here, I just want to talk a little bit about some of the logistics. If you haven't already, again, please, I invite you to share your video. It makes a big difference in these virtual convenings. Do note, however, if you do start to share verbally, which we hope you will, if you start to see that this slows down your connection, sometimes shutting off that video helps. I also want to just note that everybody is in mute right now. However, you simply have to hit unmute to speak, and we invite you to do that. We also want to note for anybody who's joining on the phone, just simply hit *6 to unmute yourself. If you haven't already, noted the chat box that gets really, really active in these calls, and we love that. If you don't know where the chat box is, simply move your cursor, and you'll see an icon down below that will show chat. Simply hit that, and that will bring up the chat box. You'll note that towards the bottom of that, the default is to everyone. So when you contribute any type of comment in the chat box, it goes to anyone. However, you are able to direct message individuals, anybody on this call. So next to that everyone, there is a little drop down arrow, and you'll be able to see everybody's name there, and you can direct message people. One of the key things of this opportunity with us coming together is to make those connections, as I mentioned earlier. Again, I want to invite those who haven't done so already to please put in your name, the community or organization with whom you are working with, and also your email address. That would be great. And I see a message potentially that I may be getting some static here on mine. So hopefully you guys can hear me on my voice. Vicki, I'm gonna actually look to you and see if people can hear me okay. Okay, I'm getting a thumbs up. So I'm gonna continue. So thanks so much. And as I was saying, please include your name, your contact information on that chat box. If for some reason you do not want your information shared, please let Joe Trotty know on our team. One of the key elements of this is to make connections and take action together. All of this, this meeting is recorded, as are breakout sessions that will happen later on in this convening. And we also share by the end of the day a contact sheet, which will include your email information. So please be sure to include that in the chat box. Of course, we want to invite you to take care of your needs. And as I already mentioned, all of this will be recorded. So let's continue about the purpose and the results that we're striving to achieve in these meetings. I did mention that there are breakout groups towards the latter part of this convening. Actually, we're going to do a little mini breakout here in just a minute. I want to mention that the breakouts are done via the magic of Zoom. You do not need to hang up and then plan to dial back in. You're automatically transported into those breakout rooms and then automatically transported back to the large group. I also want to just say that this is our opportunity to come together and share resources and offerings. That's really important, so that we can reduce duplication of services and, of course, make connections and create that safety net that is needed. The most important element of this is to actually activate ourselves and take action through this work. These calls are great to come together, lift up things that are needed, make connections, and then again, the most important element is how you're taking action in between these calls. That's where the real work starts to happen. And that, of course, is also better when those relationships are strengthened. So I'm also just going to say it again. I know it probably sounds like a broken record, but if you're able to share your video, share your contact information, that would be great. All right, let's continue here. We're going to dive right into our gracious space. Gracious space is the opportunity to allow us to introduce ourselves into this space, our voice into this space, also representing those who may not be here. And it's also the time for us to kind of center our thinking into the work that we're about to do together. So we're actually going to do this again via the power of Zoom. Everybody is going to be transported into a small breakout room, and you'll be thinking about and responding to the gracious space question up on the screen, which is, what do you need to take ownership and drive action? What do you need personally in order to do that? So reflect on that. As you're reflecting, Vicki is going to transport us all into our smaller groups. Hi, everybody. I think folks are still landing. So I want to invite you to unmute yourself. And what we're going to do is just do a quick whip around because we have about 10 minutes, maybe a little less than 10 minutes here. So I'd invite you to say your name, and a reminder of the question is, what do you need to take ownership and drive action? I'm going to pick on Tom to be our example here to help us go forward. Tom, can you start us off?
Certainly, and good morning, everybody. It's nice to see all of you here. What do I need to take ownership and action? More sleep. The simple fact is, I'm spending quite a few more hours in connecting with people around the community in this home environment than when I could get out and around. So I'm going to probably chart in maybe 20, 25-minute naps in the afternoon. That'll really help me, fresh me up.
I love it. Thanks, Tom. Anybody else is welcome to chime in. And I will mention really quickly, we're in the kind of entry room. So anybody who's joining late actually will be popping in. So I may periodically have to repeat the question. And I did notice a couple of people just joined us. So feel free to say your name. First name is great. And what do you need to take ownership and drive action? Anybody else can chime in now.
Well, I don't know how that works. You're just going to hear us? I don't know if people see us or not. This is Teresa Cuthill. I'm with the City of Bellevue Outreach Department. I'm listening in today as a representative from that group. And for me personally, it's similar to Tom. I find that my work has not decreased at all during this surreal time that we're living in, but it has actually increased because of being in outreach and projects we have going with that. But for me personally, I need to take a break during the day because it's to re-energize. So I find that to keep me going and to keep my action going, I take a break midday and go out and luckily have this beautiful weather to take a walk.
That's awesome, Teresa. Thanks so much. And yes, we can hear you and we can see you. Thanks for sharing your video. It's great to have you.
Thanks for letting me join.
Anybody can chime in.
Hey, it's Jennifer Fisher with Bellevue LifeSpring, and mine's a little different. I'm waiting for decisions from our board to be able to take ownership and drive action on some critical decisions that our board is going to need to make on April 28th. Things like the future of our Uncork the Night wine tasting and auction event that is scheduled for October 24th. Are we going to be funding a Clothes for Kids program? Are we going to be funding summer school, which we don't think is happening? So some of those critical decisions that I need programmatically, but also I can't build a budget next year until I have those decisions. So mine is a little more inwardly focused.
Awesome. Thanks, Jennifer. I appreciate it. Because we all here in this smaller group are in the welcoming room. We've had a couple of people join us. So I'm just going to ask that people say their name and just one thing that you need in order to take ownership and action. So if we could just kind of speed things up a little bit so everybody has a chance to speak, I invite the next person to jump in.
Hi, this is Amy Liu with Microsoft. I think trust and relationships always help accelerate work for me.
It's great, Amy. Thank you. Judy, I see you've joined. Cara, I see you're on. I see names.
Hey, Stephanie, this is Cara. Mine is similar to what someone said earlier. I need leadership to get their act together sometimes. You should say it that way. Act like leaders, like they're being paid to do.
All right. Thanks, Cara. Welcome. Nick, I see you there.
Yes. I'm Nicholas from NISO. I'm really bad at answering questions pretty much every time. I guess, well, I suppose kind of designating time, kind of similar to what's been said before, time for kind of break, time to, get to work, kind of splitting up the day beforehand, seeing as how there's really no one else to hold me to a schedule now, kind of have to set my own.
Yeah, that's great. Thanks, Nick. I appreciate that. Hi, Judy. Thanks for sharing your video.
Good morning. Can you tell me the prompt?
Yeah, you bet. What do you need? First of all, your name, and then what do you need to take ownership and drive action?
Hi, everybody. I'm Judy Buckmaster, Executive Director of Community Development for the Bellevue School District. Right now, direction. Because of the COVID pandemic, we've had to shift we've had to pivot quickly and priorities have shifted. So not knowing where we're headed after this is over, assuming this will be over, budgets are going to be greatly impacted, priorities will continue to shift, and so it's challenging right now to know what direction to head.
Great, thank you. I hear a theme, both for leadership, direction, and then on the other side of kind of taking a break, respite, being able to clear your head. So welcome to those who have joined. Jesse, I see you there. Thanks for sharing your video. Very quickly, we have about maybe 90 seconds left or so. Just your name and what action do you, or what do you need to take action and drive ownership?
This is Norima Amin with Global Social Business Partners. The action I need to take is to develop relationships, more relationship in the food system and entrepreneurship development space for youth innovation.
Awesome, that's great. And I will just mention, since we're running short on time, feel free to put your answer into the chat box as well so others can also see that. Anybody else want to chime in here?
I'll chime in. Hi, good morning, everyone. My name is John Tun, and I'm with King County Library System, specifically the Bellevue Library. And like everyone else, I could use a crystal ball right about now because I really need to know what we should anticipate for the next 4 weeks as we learn how to put our resources online. You know, does it make sense to put certain things online if there's a digital divide? How do we resolve the digital issues that many of our patrons have? Lack of access, lack of knowledge on using the technology.
Awesome.
Something along that line.
Thank you, John. I know people are coming back together here. If you did not have the opportunity to introduce yourself, please, and add your comment, please do so in the chat box. I invite you to do that. All right, I think we should have everybody back in. Hopefully you had the opportunity to connect in that smaller group. Again, as I was saying, as you may have been entering, if you didn't get a chance to contribute, please, I invite you to share your response to the prompt, which is what do you need to take ownership and drive action, in the chat box. And I'd also, since we're all back together, I want to invite, let's say like 3 or 4 people just to kind of popcorn out what they were able to add or contribute in their small group so everybody can hear. Don't forget to unmute, by the way.
I can go. I talked about shared understanding and support, and that was kind of a through line with a lot of our folks, was support, information, accurate data, and connections and relationships.
That's awesome. Thanks, Joe. And that reminded me, I don't think I mentioned this to everybody. If when you unmute and you're ready to share, if you can just say your name, that's really, really helpful for those, especially for those who are on the phone. So thanks, Joe, for getting us started. Anybody can offer.
John Brewer here. A few of us in our small group suggested that we needed some control of our daily schedule, because working at home, you can be on all the time. So you need to have a little bit of a schedule, take some breaks, maybe even catch a nap once in a while.
That's great, Tom. Thank you. 2 more. Oop, I see Sandy. Are you trying to speak?
I'm sorry. In my group, we spoke about needing the community voice, so needing the voices of the different stakeholders to understand their perspective, freedom to be able to take that ownership and drive to action, creativity. Yeah.
That's great. I also just want to lift up, Jesse, thanks for adding this into the chat. You need to continue to redefine the tracking system in order to tailor the approach and prioritize families and students. And I think that really gets to really the whole issue around data and understanding who we're serving and who's being missed. So thanks for adding that. I appreciate it. One more. Don't be shy. I will add then that what I heard, kind of reflecting back a little bit on what Tom talked about, is that respite, rest, and being able to just clear your mind so that you can ultimately get to a little bit of what Jesse was also talking about in that prioritization. So thanks so much, everybody, for participating in that. I appreciate it. And at this point, I'm going to turn it over to Peyton Richardson, our data officer, to take us through some data.
Thank you, Stephanie, and welcome everyone again. Happy Thursday. Thank you for joining us again. Again, we just wanted to make sure that we, continue to uplift data, and the continued aim of the data on these calls is really to, make sure you all have the data and the understanding to collaboratively drive solutions and kind of actively think about what data you might want to collect or what data you might need to continue to move forward. So this slide here just again gives us a quick summary of just the folks that have been and continue to be with us as we move from gathering and community building to looking at solutions. So this is just another thank you to, through these, I guess this is our 10th meeting, through these meetings, the amount of folks that have been represented, the amount of organizations that have convened to share resources. This is just a big thank you to all of you. So thank you. As Stephanie said earlier, we recognize that a lot of the work that is being done happens between these calls and, all throughout the day, all throughout the week during this crisis. And I just wanted to lift up a few things. These are, again, examples of the iterative work that's happening. And these were shared via the chat in Tuesday's call. And again, we really just want to say that these are data points that some of our partners and some of you all have shared with us. And it's just really, really important to continue to lift up the wins and make sure that you know the progress that you are making for the community, whether it's money spent or resources distributed and capacity reached, and sometimes capacity exceeded, both in food, and on the next slide we'll see rental assistance. Again, these are just examples. I'm sure this is not the universe of all the little and big wins, that you all have achieved, but just wanted to lift up some of the data that we heard within the chat on the last call, just to say how important it is to see the work that we're doing and how we're actually tracking those successes, because it's certainly positively affecting the population. And I see, and if folks want to drop in more numbers on the chat, please feel free. As a numbers guy, I love to see it, so thank you. So last week we talked briefly about the egg chart, and I kind of want to explain it again. And last Tuesday, and today talk a little bit about vulnerable populations. I know that was lifted up in the last call when we were looking at some of the different populations, and I wanted to just, I recognize that there are many vulnerable populations, and they're not all represented here. These are some of the vulnerable populations that A, have been raised in the call, and B, that I included on this slide. And I want to just quickly go from right to left and give a little bit of an explanation of what this is and why Eastside Pathways uses it. So when we're looking to drive solutions, we want to figure out what we're doing and with whom we are doing it, and what population is going to be most affected. So on the right, and we see vulnerable populations, vulnerable individuals in what we call the whole population, the universe, which in this case is King County. And these numbers represent King County, and for some folks that might not be the whole universe. If you're working at the state level, the universe might be the entire country, but we're going to start with King County, just so folks have an understanding of the populations that exist in King County. And then we move to the left and we have basically the system population, which is a subset of the whole population. And again, these are East King County cities. And again, and I keep stressing this, this is kind of a blueprint of how to focus. It's not necessarily exactly the geographical boundaries that you need to use, and I'll talk about that later, but really, how are we focusing the strategies? How are we focusing the tactics and the thinking around making sure that the individuals within our boundaries, where we have some control, are served? So the systems population, again, is cities in East King County. And as we go from the whole population to the subset of the system population, ideally your agency or your authority grows a little bit. You may have increased agency or authority within a specific city more so than in a county. And as we go to the left again to the population, which is a subset of the system. So we're looking at the population of vulnerable individuals in Bellevue and Lake Washington school districts. And I want to pause, and I recognize that there are other school districts who have been and will continue to be on the calls. I know I heard from North Shore and Sammamish and Issaquah. These are Bellevue and Lake Washington school districts are the data that I pulled right now. That's not to say that data is not available for other cities or that it's not important. But again, this is just a blueprint of how to really focus on the specific vulnerable populations, or any populations that you're really looking to impact. So this final population here of Bellevue and Lake Washington school districts, and this is the district, not the catchment area, but students in the district. These ideally would be populations that you may have direct authority over or a shared responsibility for. And the reason that we like to really drill down is to figure out how, what population and in what geographic area are you able to make the most impact. And it's certainly possible that one could drill down further into a specific program, whether it be a school or a provider or a grade or something of that nature. But I stopped here. But I wanted to let folks know that this is how Eastside Pathways really thinks about both data and driving to solutions, looking at the entire universe and really digging down into each subset to figure out where the challenge might be, what the most impacted community might be, and how to really focus the solutions and the thinking and the strategies on that impacted community. Because ideally, that would then kind of bounce back and affect every set above to make sure that solutions are achieved. So again, I want to recognize that this is a blueprint of how we do this work. It's not necessarily the only populations to use, but really when we look at our populations, especially here on the East Side, we like to really get truly focused. So that said, on the next slide, we have a little bit of a journal prompt, like we have had in the past few calls. So this is something to think about. For those who are on the phone or who can't see, I will read this. So the context statement is that this pandemic has disparate health, societal, and economic effects on vulnerable populations, especially those that we saw on the previous slide. The questions that I want each of you to ponder, either in your journal, personally, in the chat, verbally, are: what kinds of gaps can you imagine that exist in your data? And how are you validating whether your efforts and supports are reaching your focus population? So what kind of gaps can you imagine exist in your data? And how are you validating whether the efforts that supports all the incredible work that you're doing are reaching your focus population? So I'm going to give you guys pause and look at the chat, and please feel free to unmute yourself, and I might lift up some folks in the chat to speak a little bit further, but I'm going to stop talking now. I did say I would stop talking, but I just want to let you know, I'll give everyone about 2 to 3 minutes, and then we will start to share out. Thank you, Gloria, for lifting that up, and Tammy as well. Hearing that health needs and impacts are a gap, and Gloria, if you wanted to unmute yourself and speak a little bit about that, I think that's a really important part of folks having to prioritize very, very crucial things in their life. So if you wouldn't mind unmuting and talking a little bit about that, I think that's really important.
Okay. I've noticed nationwide and even locally that there is a struggle even with who has health insurance and who doesn't, and that's not something that a school district would typically know unless we're on the ground and we've built those relationships. For example, I have a woman on one of my teams. She is an advocate, strong advocate for kids, but even she's struggling mental health wise because of the isolation and worrying about her job. And so she has health insurance and her 2 kids, and her husband does not. And she went to 2 different places trying to get him a test for coronavirus and could not get it. And he was in the house in really bad shape for a couple of days, for more than a couple of days, for a couple of weeks. So when I think about that, go pick up food and try to make it the best they can. But that will impact learning for our students, especially online. If you have students that are worried about their parents, financially or even health-wise, that our families do want to prioritize education, but I think that's something that will impact our kids that we will see into next school year. And so that's really important to think about, and even how do we reimagine systems and not just try to get back to normal, because our normal wasn't working for so many families. And so that's something that I think about a lot around health impacts and how it will impress upon us academically with our students and our families.
Hey, Gloria, it's Stephanie. I just wanted to quickly just jump in, especially for those on the phone, and say, this is Gloria Henderson, who's with the Lake Washington School District. Thanks so much for being here and sharing that. Super
Thank
important.
you. I keep forgetting my name.
No worries.
Thanks,
We
Gloria.
gotcha.
So I'm seeing just great bits especially about validation. Helena mentioned that the city of Bellevue is really trying to see how they can continue to validate the efforts that they're putting in. And one thing that I want to lift up, I believe it was Lindsay at HopeLink, is this almost competing priority between being efficient and wanting to get as many services to as many people, which she mentioned, resulted in the programs removing a lot of client intake. And at that point, you're not necessarily getting all of the data. So I know that is it's a struggle that I imagine a lot of programs and providers are really looking at. And Lindsay, if you wouldn't mind just briefly in the next maybe 60 seconds talking about, you mentioned that relying on partnerships to fill in the service gaps. Are you speaking about the service gaps around getting services, or the service gaps in the collecting data, just for clarification?
So we for the foreseeable future, we'll continue not collecting data for the speed of service and to eliminate barriers to the food services we're providing. But in order to address the needs of the community, we are really relying on our partnerships to find out who's homebound and find solutions to get the food to people who need it.
Okay.
Also to address, language barriers.
All right. Thank you. And before we move on, I want to lift up also, Judy did mention that I think this is also an important point, is data is as accurate as it can be, and a lot of folks are reluctant to identify with some data collection points that can put them in vulnerable populations, and such as living without shelter, having a disability. There are, and we can all think of many. So I think that is also a challenge that we are all thinking of as this pandemic grows. How do we reach folks who may not be, they may fall into those gaps in the data itself, so they're not represented in the data that we have. Again, don't have a solution right now, but I'm sure we will continue to work on it. So thank you so much for those prompts, that conversation. I'm going to hand it to Sandy. Oh, wait, sorry.
Peyton,
yes.
Can I just, Lindsay, I have a question. I was wondering if Nadia was on this call. She was the one who put us in touch with a sound and I can't remember the name of it, but it's a way that people can have a phone number and call it and work with HopeLink and the city of Kirkland as far as ordering food for homebound people. Where are we with that?
Yeah, real quick. So HopeLink is partnered with Sound Generations for the city of Kirkland. We're thrilled about the partnership. It's working extremely well, and they're helping to address the homebound needs in Kirkland. We're also talking with Bellevue about doing a similar model there, and that is in development currently. I'll also just mention really quick, if it's okay, we're attending the virtual meeting for the NISO promoters meeting tonight to speak with the Latino community and hopefully address some of their questions about meeting needs.
That is wonderful. Sandy?
Super, thanks, Peyton. Hello, everyone. This kind of gives us a great segue into the large group sharing. And as we are reflecting on the data that Peyton just shared and all the data that you're tracking, it's important to kind of hold that data optics as we are creating solutions, thinking about how much are you doing, how well are you doing, and is anyone better off? Using this data to stay accountable to each other and to ourselves. I'd like to now move us into the large group. You can see some topics here, and these topics have been raised by you via the chat in different platforms as being important to hold a discussion and share resources and think about solutioning. So we will be talking about funding that you need to sustain and increase capacity. In the last call, we heard Helen and Paul Wally speak about how there is a need, there is an overflowing need, and they are at their maximum capacity. So if we could talk more about funding, social, emotional, mental, and physical health, we heard how it's even more critical to have services and supports for the community in these times. We also heard from the community about how they are experiencing fear and anxiety. So to talk about that, and information accessibility. This has been raised as a theme consistently in talking about if providers could think about the platforms and channels, also languages, that they are sharing their information so that it reaches a wider audience. We will also have space, like every time, for anything that's emergent and burning for you. So the prompt question for our large group sharing before I go on mute and invite you folks to share via chat or by unmuting yourself is, how are these factors uniquely impacting your focus population? So think about how these themes that we have raised for today's discussion, how are these factors uniquely impacting your focus population? And modeling for us, we can't be charting. Charting is a big part of Eastside Pathways convening. We'll have Peyton Richardson here. So thank you, Peyton, for whiteboarding for us. And now go on mute and invite folks to unmute themselves and share. I do see that we have funding agencies like Obama, Microsoft, United Way here. Does any of you want to speak about flexible funding and how you're supporting? I also saw some great information being shared in the chat. Can I invite one of you to unmute yourself and speak about funding specifically?
Hi, Sandy, it's Amy from Microsoft. Our Puget Sound grants are general operating grants and have been for some time, which is great. And we've tried to increase funding to a couple partners on the east side. We have also tried to engage our employee giving by supporting the regional funds. But as you can imagine, we're just getting inundated with asks. There's just so much need out there.
Hey, Amy, it's Stephanie. I have a quick question as a follow-up, or for anybody who might know. I know that there are a number of different organizations that are also, who are funders, who are also pivoting to provide funding through this crisis. For example, I know the Tableau Foundation has a grant RFP out there. I don't know the details on it. I'm wondering if any of you are familiar with if there's one place where organizations could go. Maybe it's something like Northwest Philanthropy, I have no idea, that is keeping up on where those funding opportunities might be that would be outside of the ordinary for community-based organizations.
It's a great question, Stephanie. I don't know of one, unfortunately, is the short answer. I don't know if there are other funders on the call who know.
Can I invite anybody else? Casey, I see that we have a few other representatives from funding organizations. Anybody else would like to chime in?
Yes, I'm Christy Mintier, and I'm the Bellevue School District Executive Assistant to Bellevue Schools Foundation. I'm here representing the foundation. And many of you may know that our big luncheon, the Spring for Schools luncheon, which is normally right around May 1st, would have been May 1st this year, has been canceled. And that usually brings in $800,000 just in the luncheon. So we have been pivoting to have a virtual luncheon or virtual fundraising. And so far that's going okay, but a lot of the money comes in day of, so we don't know how this coronavirus is going to impact our fundraising. Right now, we've been doing a lot of individual and corporate outreach and applying for every grant that's out there that seems potential. So that's where the money's coming in from, and right now we just have no way to know how we're going to do, but we're hopeful. And then in terms of pivot, I put in the chat last time that the Bellevue Schools Foundation is going to be diverting some of the funds from money that would not have been used because school was gone virtual. So some of those funds are being diverted to go to LifeSpring. As of right now, $40,000 will go to buy Safeway food vouchers that will be then given to the Bellevue School District to distribute to needy families. So that's how the Bellevue Schools Foundation is doing the best they can to pivot with both their funding and their client group. So, thanks.
Yeah, thank you for sharing, Christy. I do see a comment from Susan. And Susan, if you're willing to unmute yourself and speak more to the suggestion that you have about having a common app for funding during this crisis?
Yes, this is Susan Sullivan. I'm a community member. It just occurred to me when Amy and Stephanie were talking, Stephanie about mentioning Philanthropy Northwest, and if they were more of a clearinghouse for everybody that's stepping up as a funder to just create a central place for nonprofits, service providers to go to find out where there are new opportunities. And I think a significant benefit of that would also be to have a single common app at this time, just to relieve the burden from nonprofits of applying for funding and focus on providing services. It's been talked about in other grant processes, but it's never really been done. And I think this is a great opportunity for streamlining.
Mm-hmm. Thank you for sharing, Susan. I want to lift up Helena's comment on, do we have a representative from any of the chambers who can speak to the efforts that have been, that are being put around fundraising?
Hey, it's Sandy, it's Stephanie. I can speak briefly just via conversations I've had with the Bellevue Chamber as well as One Redmond, which is the Redmond Chamber. The Redmond Chamber actually has started they've gone into another DBA calling themselves, doing business as, calling themselves One Eastside, and creating a site. They actually are ready to process funds that will help small businesses. And that actually is up and running right now. They've The first one they're doing is for the herb farm, for those that are familiar with that, in Woodinville. And they're kind of the test case, if you will. So I think they're in early stages of that, but they've been able to quickly get the foundation and infrastructure set up, and we'll likely be looking at expanding that more vocally through community relations in the short term here in a few weeks.
Thanks for giving us the update, Stephanie. I'd like to move us along to our next theme, really thinking about the social, emotional, mental, and physical health. I did have an email exchange with Kathy from Westminster, who spoke about the intentionality that Westminster is putting in on supporting their community. So Kathy, can I invite you to speak a little bit about what you're doing in association with YMCA?
Hi, this is Kathy. We have collaborated with Heather over at the Bellevue YMCA, and we actually are setting up a line where click a link and click a phone number, and we're going to rotate a chaplain of the day through that to speak to emotional issues that they might be having, and have someone each day that is on the receiving end of those phone calls that can help them navigate some of those issues. And so we're getting it set up to hopefully be in place completely by next week, and looking at just how long this will go, because we realize that the need is going to be longer than the next few weeks.
Mm-hmm.
And so that's one thing we are doing actively with Heather over at the Bellevue YMCA. And then we're also looking at just trying to figure out better ways to make our resources available. Many of you know Westminster has a robust mental health program,
mm-hmm.
but we're trying to figure out how to tap, because there's only so much we can do. So we're trying to figure out how to collaborate well with the partners in the community.
Thank you so much for sharing, Kathy. I also want to lift up that there are some great resources being shared in our chat. Jack from EBC just shared about the Philanthropy Northwest list of COVID-19 funds, and Helena shared about the services that LifeWire has specific to social emotional support. Can I invite a community member to speak about the kind of needs that you're hearing from the community specific to their social emotional well-being? Helen Wong from CISC, would you like to unmute yourself and speak about what you're hearing from the community, the focus population that you serve, and how supported are they feeling?
Hi. We just had this conversation the other day about how a lot of our staff are also community members.
Mm-hmm.
So when we meet around, it's how to take care, just bringing and lifting up some of the things that are going through, both personally and professionally. I think, fear of the unknown. Definitely, there's income issues. We're also dealing as a community around fear of discrimination. What would be the impact for our families when things go back to normal? I think isolation, getting out accurate information that is translated, that is current and relevant, dealing with waiting periods, and just not getting, I think, the access to information as quickly and as accurately as possible.
Mm-hmm. And Helen, can I ask you to share with us, are there any innovative channels or strategies that you're using which has come from the community that you serve as being effective to help reach the information to them? In in I think the last call, Liliana from Padres Unidos has spoken about how phone calls and videos, sharing videos via text, she realized was a good way to reach and spread the message with the Latino community. So are there any channels that you're realizing that's coming up from the community specifically that you serve as effective channels to share information?
Absolutely. I mean, we are doing wellness calls. We're trying to reach out to our 8,000 clients, so it's taking some time. But I think also it's about having that established pre-existing relationship and asking really pointed questions about, do you have all the medications? What's worrying you? You know, having open-ended questions and really sort of figuring out what their needs are at this point in regards to food access, what their worries are. So I think really just meeting them where they're at and then gathering that data to be able to adapt our programs to reach out to those that are in need.
Thank you so much for sharing, Helen. Cassandra, can I invite you here? I read from the chat, you speaking specifically about parents with children with special needs. Do you want to speak more to that, please?
Sure. I should preface that. I'm Cassandra with the Lake Washington School District Board of Directors, and we have a child with autism at home, so I can speak personally to the complete disruption, of course, in his life. But parents actually all over the county have been reaching out who know me and struggling with an uptake in physical aggression from their students with, or their children with developmental disabilities. And, you know, I'm speculating that it's because of so much change to their day and their schedule, and everything that they knew is now pretty much gone. And trying to do any kind of education with them right now is not only time consuming, but sometimes approaches violence, unfortunately. And I'm wondering who in the area has specific skills to deal with that type of situation.
We did have representatives from Kindering, and I see that being mentioned in the chat as well. We did have representatives from Kindering who spoke specifically to be for how they were pivoting and providing their services virtually to their families. Is there anybody else that knows of providers that are serving children or adults with disabilities?
And I would add that it's, you know, all ages. Thank you, Kindering.
Thanks, Cassandra, for sharing. I'd like to invite...
May I speak up really quick? This is Katrina Miller from Kindering Center.
Yes, Katrina, please.
Hi, I just wanted to add that we are known as a birth to 3 center servicing children just 0 to 3 years of age. However, we do service children up to 10 years of age in what's called our kids clinic, so our private side of offering services. And we are currently offering all services in the area of speech therapy, occupational therapy, and physical therapy via virtual telemedicine. We also have a area that is childcare and preschool consultation, and we are also offering services and support via either phone calls or Zoom calls for parents that need that support. And we are still working out that process on how to support families, but those things are being offered.
That's amazing. Is there a way to access, or are you quite ready for us to start inundating you?
Yes, we do. You can call Kindering Center's main line. And I can give that out if everyone wants that. It's 425-747-4004, and they will intake your need. It's basically our intake line, and you can listen to the prompts, and then it will send you to where you need to go to get either an evaluation and or kids clinic services.
Excellent. Thank you so much for sharing, Katrina. I just want to let everybody know that in the follow-up email after every call that comes to you in the evening of the day that we've had the call, you will have links to a Google Drive, which has the recording, the cleaned up chat transcript, and this whiteboarding. So all these resources will be available to you. I'd like us to now move on to the breakout session. So while we have Joe take the controls of the screen share from Peyton, thank you so much for sharing all these rich resources. We will continue to lift up topics that are coming up as we convene you all. In the last call on Tuesday, we asked you, we did a poll where we wanted to hear from you the extent to which you are committed to shifting ownership to youth and families. So this graph speaks specifically to the youth. We had 26 of you that took this poll, and a large portion of the response said very committed. We saw similar numbers in the family ownership as well. I'd like to point out to take a pause and think about, there's one thing to say that we're all committed to shifting ownership, and then there is also a deeper intentionality that goes behind how are we giving the authority to this population so that they can take the ownership and drive it to action. So that is really what I'd like you to hold and ponder on as we move you into the breakout session. You've been seeing the scale, we've been sharing the scale with you in the last few calls, where when we started off reacting to this emergency, coming together and creating solutions, we were in the technical space because that's the known solutions, that's the space where we were informing people about where the food sites are, or where is childcare, and how many, what kind of services is available, and in what kind of a time window. All of that is technical solutions. And through this journey, we're all moving towards the adaptive solutions, where we are thinking about collaborating, empowering the populations that we are working with. So in the breakout session, your prompt question is, what action or can you take to discover what your audience needs to take ownership in developing and leading solutions? And before Vicky, again, magically moves you into your breakout sessions, you told us that breakout sessions with facilitators were more effective. So in addition to the Backbone team, I'd like to shout out to Kathy and Tom, who are a part of our board, the Eastside Pathways board, who have agreed to facilitate the breakout session for you. Also, continuous improvement is a big part of how we work and how we make sure that you get what you're looking for from these calls. So you have a 20-minute breakout session, and then I'd like to request you all to stay so that you can take a continuous improvement poll. It shouldn't take more than 30 seconds. So that poll will be introduced to you right after the breakout session. So I'm hoping that you all stay with us and give us your feedback. So at this point, you will be divided magically into smaller groups, and the conversation that you'll be having is around what actions can you take in your role to discover what your audience needs to take ownership in developing and leading solutions.
Hi, everyone. Can folks hear me? I have put up the question there. Hopefully you can see that as well, just as a reminder for us, because I don't know about other folks, but it's hard for me to remember some things from minute to minute nowadays. So there you go. Again, my name is Joe Trotti. I'm the communications manager with Eastside Pathways. And what we wanted to discuss today in our breakout session was, what actions can you take to discover what your audience needs to take ownership, right, to develop and then implement or execute or lead solutions to what's going on. This ties back a bit to our gracious space question, so hopefully that sort of got the gears turning so that we can talk more about this. And everything from technical solutions, which are always welcome, which are the kind of the known things and the easier things to do, to the adaptive solutions. This, I think, skews more towards the adaptive side as far as, right, how can we keep these affected populations front and center, and what can we do to help them co-design solutions? So I'm going to be quiet now and open it up for other people to talk.
Hi, Joe, and everyone. I will go first because I actually need to hop off, but I wanted to share. My name is
Gargi.
My name is Gargi Trushell. I'm with the Bellevue School District. I am one of 2 family engagement coordinators for the district, and we are have been tasked to create some opportunities for families to engage in conversations about social emotional health. And we hear that a lot, social emotional health and mental health during this time. And what we've decided to do is actually to ask parents the question of what concerns do you have? What are the areas of anxiety and fear that you feel that you have? So we just sent all our district families this question so that in creating these online forums, we're using our Bellevue School District counseling staff. We've partnered with YES and with Consejo, and we're looking to partner with anyone else who can help support these efforts. But we want to have these forums tailored to what the actual concerns and worries that our parent community has. So that's the way that we're trying to involve the parent voice in creating opportunities for dialogue.
Cool. So are you convening like meetings like these for them, or is it just sort of a one-on-one feedback you're asking? How does that work?
We are creating these types of forums for them where the themes that we see come up as families respond and generate for us what the forum be about and who should be part of that conversation. We're not sure yet how they'll look in terms of whether or not they'll be by school level, whether the concerns of the elementary population are one, and then of secondary populations are different concerns. But we are waiting for that feedback before we form what they'll look like. We're waiting for that to instruct us.
Great. Who else would like to contribute?
Just one thing real quick.
Oh, yeah.
So I didn't mention that I needed to leave at 11. So I just wanted to share that. And if anyone has any suggestions or feedback or partnerships on that front, my email is available, and I'm really looking forward to working on this with people.
Thanks, Gargi. We understand when people have to drop off, so no worries.
Thank you. Bye-bye.
Other folks?
My name's Liz. Hi, I'm with the Eastside Human Services Forum, and this is a little more removed, but this group is in the middle of starting an organizational review to kind of think about what its role should be in the future. And so the audience is other nonprofits, including city governments. Mm-hmm. So one of the things that we've talked about lately is changing our work plan for the year to prioritize COVID response, an organizational review, and some legislative advocacy, and then either doing some, Survey Monkey or one-on-one conversations to kind of ask, how might the forum be of service to you? What's your biggest challenge right now? And what do you need from the forum? So
and when you say you, you're talking about other nonprofits?
Yes, on the east side.
Right, to be clear.
So we're looking at either one-on-one conversations to get at those questions, and one would hope that it would lead to ownership in developing and leading solutions.
Yeah, and a good question to ask those folks as well.
Yeah, like just trying to reappraise our role in light of what's going on.
Right.
I can go, Joe.
Cool. Thanks,
Jesse. Yeah, my name is Jesse Franklin. I'm with Rainer Athletes. We're a long-term mentoring program
based in the Bellevue School District, serving students starting in 5th grade all the way through their high school graduation. We have about 100 families that we're working with, and typically we're meeting, our mentors are meeting students in school, and then we're connecting with families in different ways outside of school. And it's completely changed with this virtual environment, obviously, but our mentors are still checking in with students. And something that we've had in the past that's been super successful is our family circle advisory team. It's essentially 11, we call them super moms, that meet about once a month, twice a month, and there's essentially serve as our ears for the community. And they, right now during this crisis, actually come together virtually and have kind of come up with a list of questions that now they're going out and asking the community of families to just determine needs, be a voice, be an ear, just be someone to listen to and talk with. And then we've also kind of come up with a list of different resources that are available to families, and we've trained the family advisory team as to what those resources are. And so that when they are assessing some of those needs, they're also able to direct families to those providers, whether it's rent assistance or navigating unemployment or food or childcare. And so, yeah, we've already had this in place in the past, and now we've kind of just migrated to a virtual environment. And these moms are incredible, and these are the moms that are being served by Rainier Athletes, and then also at the same time helping Rainier Athletes as a community serve the larger community.
Fantastic. Others?
This is Jamie with Kids Quest Children's Museum, and right now we have been switching all of our educational models and are just really looking to work with our partners to find out what it is that people need in the community. So we've reached out with the Bellevue School District with their before and after school care, the Boys and Girls Club, the library systems, who have a really good pulse on people that they serve that are no longer getting to serve, and just starting to reach out to the community to find out what are the needs that people are explaining to them that they're finding around virtual learning, what they're finding struggles with, what resources they might need. We are starting to put together boxes, physical boxes that could go out to families, and these organizations are helping to identify who those families could be. So, and then what families are saying that they need that we could put in those boxes. So right now we're just trying to be the resource gatherers, and then find the materials that could go into those boxes and then give those to those organizations to then be able to give out. As an informal learning institution, we really believe in materials and children being able to manipulate those materials how they see fit. So really making sure that when listening to families, we're not giving them more things to quote unquote do, but really giving them things that would be useful for their children and for what this new world of remote learning and learning and what I like to kind of like learning in isolation. They've done so much learning with peers. So now this is a very different type of learning. So just really trying to use all of our background that we understand and know, and then leaning on all of our partners to let us know what they've heard.
Right. So that the folks that actually are receiving the boxes are helping design what goes into the boxes. Cool. Anyone else? Got some time, got about 5 minutes to go.
Well, Pantry Packs is a specific service. So we've been working with the school district and the counselors to make sure that kids are getting the packs. We don't have direct contact of the families, so we're kind of limited on what we can do, but we're making sure that the packs are getting out and that we're working with the school district. And the school district, we're Lake Washington School District, and they have come up with a resource flyer that will now be going out with the pantry packs too. So we're working on that.
That's great. that was certainly a theme we heard all last week, was what kind of channels can we use to get information out to people?
So Jamie, I was going to ask you, wasn't learning boxes something that the libraries used to do for preschool kids way back?
Yeah, so they still actually have them. I cannot remember what they're called. They're on a set of different notes that I don't have in front of me. But they did have those. Those are much more like curriculum-based sets, and we're trying to do a lot more play-based things that parents don't necessarily have to be sitting next to their children in order for the children to be doing. A lot of what we've already heard from parents is that juggling their work schedule or providing for their family and then having to do the learning alongside their children has been a really big struggle. So we're really trying to put together things that they're going to be segregated by age, but that children would be able to work on independently. But
So
yes,
do they
I did look
keep
at
these things, or is this a loaner?
Nope, they'll get to
Okay.
keep them. Yeah, they'll be kept.
So Jamie, are you just Bellevue School District, or do you help the Lake Washington School District as well?
I have a email in my inbox from somebody in the Lake Washington School District that got connected with our CEO. So I will be reaching out to them today.
Cool.
Things are happening. Good things are happening. Adaptive things are happening. It's great. So when we come back, I will do my best to summarize some of the stuff I've heard. If I miss the marker bit, or someone wants to jump in and add some more detail or color commentary, please feel free to do so. Help me out.
So is there any sheets or anything of like what all the organizations that are on Eastside Pathways calls their needs are?
There is, in fact. If you go to the Google Drive link that will go out in today's email, there is a list of strategies and services that have been made available or that are available from the participants in these calls. We haven't updated it this week, but it might be a good idea to think about doing that based on all of these new things that are going on, that people have got going on. But certainly you can go there and access that, and I will actually bring that up in our review call that we have with this afternoon to make sure that we keep that a living document.
And that's in like the meeting documents?
Yeah, yeah.
So do you know which meeting document it is?
I will make sure that it is included in today's, we create a folder for each day. I will make sure that's included in today's folder along with all of these video recordings and then a cleaned up transcript of the whiteboarding that Peyton did, as well as all of the chat conversations.
So if you have needs, can you add to that then, or how does that work?
I will make sure that it is an open document that people can add to. It's typically not needs as much as it is services that are offered or provided.
Okay.
But I'll have that conversation with the team after this call.
Because one of the things that came up with us is we started a Google document for volunteers, and I think our volunteer base is about 100 that are just because of the COVID, and we're willing to send something out. We just don't want to be the holder of that, but to be able to say, you know, these organizations need help, and if you want to help them, here's the contact information.
Right. I think Bellevue Chamber of Commerce also has a mechanism set up for that on their landing page.
They do.
I was just thinking of a way to connect people that want to help and don't know where to help.
There's that as well. They have like, it's like click here if you need something, click here if you have something to offer.
Okay. So that's Bellevue, and we're Lake Washington. Do you know if there's anything for Lake Washington?
I don't. I think it's grown beyond just Bellevue as well, though. Yeah, that's the Chamber of Commerce.
Okay, I'll look it up.
Because needs certainly don't stop at city boundaries.
Exactly.
Bellevue Chambers also hosted some pretty good webinars. I went on one that was kind of like best practices on teleworking, and there was one with Eastside legislators not too long ago. So I think they're trying to take a larger role than just the city.
Okay.
So I just got a message that they extended this breakout session by another couple of minutes. So I don't know, can you guys see the little message there that says we've got 108 seconds?
Mm-hmm.
All right, I never know who can see what when that's on different people's screens. That's why I also decided I'm going down to just one monitor when I do these things, so I don't have to worry about that. I used to have a second monitor set up to try to monitor chat stuff and realize that's just, I can only hold so many things in my head at one time. Plus, again, I never know who's seeing what, so.
So I don't think we heard from John Tunn.
John, anything you'd like to add? You have 75 seconds.
Hi, good morning, everyone. I just added something on chat. You know, you talked about the kits, the library kits that we have, and they are called Books to Grow On. They're these large tote-like kits with various tactile as well as book and audio material, audio, video, usually audio. They are unfortunately not available because we have no access to our facilities at this point until we open back in phases. This is something that I think would be very useful, but I think it would be similar to what the museum is doing. I think it would be much better if the kits can be made so that the family can keep them. That would be the best way to go, I think.
Yep.
John, what organization are you with?
I'm with the King County Library System. I generally work at the Bellevue and Lake Hills and Crossroad area.
I remember how excited I used to be when the big box from Scholastic Books would show up in the classroom.
Absolutely.
All right, here we go, folks.
All right.
Thank you, John.
All right, here we are.
Hi, I'm so sorry. I actually have to jump off right now. I wish I could
Okay.
be here.
All right.
Hi,
Bye,
everyone.
Lindsay.
Thank
Bye,
you.
Lindsay.
Hi, Lindsay.
All right, so I'm going to make sure that we have our, so that we can see what the prompt is for today. And you're not sharing the proper thing. Okay, so our effective question is, what actions can you take to discover what your audience needs to take ownership in developing or leading solutions? So when we were thinking about this question, I know that we wanted to make sure that we were staying in line with how are we developing solutions and informing and consulting and empowering both youth and families. And one of the things we realized is that having youth and families that are empowered is important, but how can they have ownership of some of those solutions, and what does that look like? And we realized that that would be it would be good to thought partnership with all of you to figure out what actions could you take to essentially make families and youth more comfortable, feel more accepted in the space, so that when they take ownership, they know that it is real, authentic, and won't be kind of snatched back if this, when this pandemic goes away. So just what thoughts does this question bring up for all of you in your role?
You'll have to excuse my fussing toddler in the background. That's why I'm
okay.
muted. But so some of the things that the city of Kirkland is doing is figuring out ways to engage the our youth council, our senior council. I know we talked about this a little bit on the last call, and also our human services commissioners, because they're really folks that are intended to represent the voices of our residents in the community. So our youth council is doing some pretty cool stuff. They're organizing a virtual summit for the youth in our community, and that's all being youth-led, youth-organized. This is an initiative that they wanted, something that they wanted to do, and they're developing the agenda, and they're bringing on a panel of experts to help provide services both during, to identify needs, to provide some support to youth in the community. And we're working with our senior council and human services commission as well to get their voices represented in the work that we're doing right now.
Excellent. And I see that, Helena, you raised your hand. I just have one question. Amy, you mentioned that it's a youth-led and organized. Are they organizing just like a more of a conference, or is it like a meeting? I missed that.
So it's intent. They usually have every other year. They have an in-person summit, and it's going to be a little bit different from that. It's going to be virtual. My understanding is that the capacity is they can have 500 participants live at the summit, who will be able to interact with. I think it's still a work in progress, but my understanding is that there are going to be some experts, some behavioral health experts, some physical fitness experts. They're going to have school counselors, and have, they also are, we're hearing that the youth want more factual information from public health officials as well. So they're going to have a public health expert on there, who will present some information, and then there'll be some, I don't know exactly what capacity, Q&A with the youth and the experts there, and youth among themselves perhaps as well. I'm sure there'll be space for that. So yeah, does that answer your question?
Yes, thank you.
Yeah, absolutely.
And Helena, you raised your hand.
Yeah, what I wanted to say is that similar to Kirkland, I mean, we have our community boards and commissions that we get regular feedback from, but what was brought to my attention yesterday was the need for the community to get their voices heard in a couple of different ways. One, more immediately back to council, to city council, and also how could they give us feedback as to how effective our website and resource information, whether it's been electronic or non-electronic, has been for them, so that we can adjust and make changes right away. So we are now working with our communications team to set up mechanisms for the community to be able to give us feedback as to how effective we're being, getting the information out to them. One of the immediate changes that that we made yesterday, and will be in the third set of non-electronic flyers that will be printed, is that we had not been doing a good job of reaching out to the non-literate communities. And so now we have put in symbols on all of our non-electronic flyers so that anybody can pick up the flyer and do not have to be able to read. All they need to be able to do is to see the symbol attached in that particular area and call the number. So we're working on mechanisms on how we can be more nimble and give faster response back to what the community wants.
Thanks for sharing that, Helen. I really appreciate that. I'm curious, I don't know if you have this information now, or if you could share it in the future, kind of what methods your communications team comes up with to solicit that feedback and to reach folks. Is that
on which area?
You were saying that you're working with the communications team to solicit feedback from the community. I'm just curious what mechanisms your communications team comes up with to get that feedback, because Kirkland is interested in that as well. You can all learn from one another, right?
Yeah, no, I'll be happy to do that. It's only fair because we've stolen several of your ideas.
Happy to share back and forth, right? We're all a team here.
Collaboration.
Thank you. Yes.
Thank you. Thank you. Thank you. So I want to make sure that everyone does have a chance to speak. I know we have some new folks to the Eastside Pathways call. But, you know, as we think about how we are making sure that, you know, like Helena said, you know, communities that fall in different gaps, especially like the non-literate communities, how are we making sure that we can give ownership back to the community so that they can actually say and give the feedback that there are still folks that, despite translated and in paper form, are not getting the information. I think that's really powerful for me to realize that there are still gaps in my thinking. But just for some other folks, what are actions that you may be taking? And this comes up a lot in these calls, but what previously was not possible that, you know, this situation has kind of forced into the realm of possibility? That's just something that I think about when we're looking at different solutions, like what used to be impossible or something that was not feasible that now, you know, has to be done because there are no other good options.
Hi, this is Kathy. I know for us, we do a lot of stuff. We're doing a lot of phone calls right now because a lot of people, for whatever reason, are not getting to the information. And just like a personal invite to something makes a difference, the personal phone call actually gets to the heart of what's being needed. So I do believe that, you know, personal phone calls or a personal email, not just a blast, makes a difference. I did that just yesterday with a gentleman I know who's like a volunteer pastor and a BSD bus driver of a small Hispanic church, and found out just how much need there is in his church. And I spent most of this meeting networking with a couple people to get him resources because he's just unaware. Mm-hmm. And so I think part of it is not assuming that people we know in our extended network are getting the information or that someone else has contacted them. I'd rather have the redundancy of contacting them and saying, oh yeah, I got some help, thanks, than someone never being contacted because we assume they are finding the information some other way.
Mm-hmm.
We are doing that as well, Kathy, from Kindering Center. We are calling and going through our list of people that we normally work with and that we have community relationships with, and we are doing personal phone calls to touch base with everyone. So that seemingly has been more helpful than doing an email touch point or just an email blast like you suggested.
That personal touch is huge, isn't it?
Yeah. Yep, that's been really huge.
And I guess that definitely is helpful through these emails, and I guess the personal emails have either of you or any of you really seen that folks are bringing up additional ways that they either want to be involved or pointing out other members or sectors of the community that are either not getting reached or that are getting reached in a way that isn't as helpful as you may have hoped?
I think one thing that's a little overwhelming when I do make contact with people who are ESL, immigrants, whatever, their needs, while they have the needs here, their heart is really broken by what's happening in Venezuela and Guatemala and around the globe. Mm-hmm. And so it's twofold. So it's a little bit overwhelming sometimes to reach out because you're trying to help and then it just explodes globally very quickly in a conversation. Mm-hmm.
So their community is far beyond these geographic borders, but
right. You know, like when I spoke with Claudio yesterday, he said in Venezuela the inflation it's gone up like 3,000% mm-hmm. during this time. So $3 does not do hard, which was very little to begin with. Now is virtually non-existent.
Right.
For us, it seems like sometimes touching base with people who know that their child might need that extra support or care, but their work is too inundating at this point or creating too much in their life because there's a lot of shifting in people's work as well. And They just don't have the capacity or time that they can put into to accessing a service at this point, because they are in basic survival mode, are things that we have found as well.
So at the city, we've asked our departments, and especially folks who have worked in the community centers, to start developing a list of participants and clients who normally would come into the community center that they haven't heard from, that they fear might be in isolation, so that there can be ways that we can start reaching out to folks. We've been in discussion with Bellevue Fire Cares, which is on this call today in another group, because they actually send teams of people out. And we've been talking about how can we gather volunteers to check on folks who are isolated. So that doesn't necessarily mean grocery deliveries. It might mean that, but it might mean just making phone calls to those folks or knocking on their doors just to make sure that they're okay.
Mm. That's helpful. Lisa, I want to make sure that you have an opportunity to answer the question if you had any thoughts about what might it take for you to discover kind of what your audience needs to take ownership. I know this is I think you said this was your first Eastside Pathways call, but I wanted to make sure that your voice got heard here.
It is, and the program that I run is all volunteer to provide tutoring. However, right now there has been a shift to making sure that these families, because they're all immigrants and refugees, are connected to the resources they need. They're hit harder than the general population, which we all know. What I've been doing is a lot of the one-on-one phone calls, the personal touch, but also using Zoom. And I'm able to build relationships in a different way because everyone's at home. So the schedule flexibility is different than than before. So I've been able to put together tutors and families and students and have them all work together to come up with their solutions. I've really reminded everyone that we're all pioneers trailblazing a new way of doing this right now. I've been able to group tutors together based on the age of the student they're working with, because we have K through 12, and what tutors who are working with 9 through 12 need to do compared to 6 through 8 and kindergarten through 3rd. It's just different. And so we're able to come together to develop relationship in a slightly different way to come up with solutions. And I have more information about what I need to do to support the process. I'm real excited about this because this is going to help me to further empower my audience, I guess, based on the words here. So yeah, that's kind of what I'm doing.
Thank you. It's really, and one of the things that I'm hearing, is that some of it's necessary and a lot of it is conscious as to the way that we're talking about building relationships differently, because all of us in the work that we do have, the way that we build relationships, but whether it is, making different connections in a different way or allowing folks to go, giving them a little bit and allowing them to go, whether it's organize a summit or, just to really talk about what their community means to them and how that actually impacts, or, just making sure that each and every person hears from you in a way that is more personal and probably a little bit more taxing for you, but seems to yield better results in terms of allowing folks into helping them strategize their own solutions. I think that's one of my main takeaways, is building relationships differently.
And I do think that this program's been around since 2001, and it's small enough to be close-knit. But I think that this is actually going to make the community even stronger and closer in the end.
That is great. So we have a little under 2 minutes left. My little countdown clock, which you may or may not be able to see, is right here. But I wanted to make sure that I allowed folks to really speak what they wanted to, and to think again as we, have a lot of technical solutions, like moving toward those adaptive solutions. And I think again, I heard many things, but I think the one thing that ties them together is building relationships differently, because when folks have that trust, and when they feel that each of you is reaching out personally and giving them the ownership to either speak their truth or to organize their solutions, it certainly will allow for folks to be more willing to take ownership, and more willing to speak up and step up when in regular times, or unfortunately in these kind of crisis times. So thank you for hanging out in the breakout room.
Thanks for leading us, Peyton. Good job.
So we do have 45 more seconds. I hope everyone's doing well.
Yeah. One thing I've heard us talk about in these groups a lot is the newly needy. And I think a need to message things specifically for them, because they may have not reached out for services before, and there may be a stigma to reaching services. So I think that's a kind of a gap in a lot of the communications right now, is how to really tailor messaging to those who haven't needed services before, but now do because of this crisis.
We have 4 seconds, so I'm not going to ask you to dive further, but I'm interested in.
Hi, everyone. Welcome to our breakout session. I see that we are a smaller group of 7 participants. Today we spoke about keeping the data optics on as we are creating solutions. It is important for us to think about, what do our focus population need to take the ownership? We heard from all of you, and you said you're ready and committed to shifting the ownership to your focus population, specifically the youth and the families. So what actions can you take so you can learn what your focus population needs to not only take that ownership, but be able to drive action from it? So the way that we will share is, I'll be taking notes for you, but please feel free to unmute yourself and introduce your name and then share your responses.
This is Teresa Cudhill. I have to apologize. I have to jump off. I didn't realize this was going till 11:30, and I have another call I have to join. So my apologies, and good luck with the breakout session.
We will miss you, Teresa, and thanks for letting us know.
Thanks.
Can I invite one of you to unmute yourself and speak about what actions can you take in your role so that you can learn from your audience what it means to empower them, how can they feel empowered, and how can you transfer that authority so they can drive action?
Hello?
Yes, Liliana.
Hi, how are you? This is Liliana Medina from Padres Unidos and Sistema Escolar USA. I just want to tell you, I am the one that been like bugging about the video and sending the text. And I just want to tell you what we did and how are we just moving like things around here. With Lake Washington School District, we talked to them to see if there was a possibility to start sending the messages, like the information via text messages. So starting next week, they are going to start a big campaign to ask people to register to receive information via text messaging. So from us as Padres Unidos, we are being like connecting people. Like, let's say yesterday I contact one of our interpreters that she's working with families, trying to help them to understand how to set up teams to be able to connect with the teachers. But she's doing one by one. So I asked her, and her husband is helping her. So I said, you know what? No, let's record this and let's share it with our people. And what we are doing is we are sharing. We have in Padres Unidos, we have 100 phone numbers registered that authorize us to send them messages. So we send them a message with a couple of links, a couple of information, but we ask them please share this. Don't keep it for yourself. If we share it just with one person, our outreach will be 200 people instead of 100. And if they do it for one only person, then it will be 400. So that's how we are doing it. And we are asking our community to share. We are also sharing in different places in like Washington. So if you know people that live in Kirkland, Redmond, and Sammamish, please share this information with them, because maybe they are not in our database, but we still need them to know about this information. And we got a good response. So we are going to start next week with the text messaging information campaign. And we cannot be happier with the response of Lake Washington School District to our suggestion, because they took it seriously and they start the right actions toward that. So I can see that at least we are trying, and I'm pretty sure that if we keep pushing on this, people will feel empowered just to take actions.
Excellent. Thank you so much for sharing, Liliana. And thank you for pivoting your services so that the community is heard and they can be reached in ways and feel empowered in ways that they said would work best for them. Can I invite, yes, Tammy, I see your hand.
Liliana, can I ask a question? This is with Lake Washington School District, and it's text messaging with the school in cooperation with the school. Is that?
Tammy, you broke up in the last part. Did you say the text message? Go ahead.
Liliana, you're with Lake Washington School District, am I correct?
I don't work for Lake Washington School District. We are part of a volunteer parents that are working, like that our kids are in Lake Washington School District.
Who did you get in touch with the Lake Washington School District? Who should I bring to this conversation?
Actually, Gloria Henderson was on the big group session. She is the director of equity and equality. So you can contact her. She's one, we Padres Unidos are under her department, just to have like an umbrella, like a legal umbrella. So you can contact her and she can pass whatever you need to Matt Gillingham and Shannon Patterson that are responsible for. Matt is the associate superintendent and Shannon Patterson is the communications, like director of communications.
Okay, so it would mean I want to be really clear on this. If I were to get Shamari Jones, who's the head of equity for Bellevue School District, in connection with Michael May, who is the director of communications, and get them talking about duplicating what you're doing, I may make some headway?
Absolutely.
Yes.
That's it. I need to know who to go to.
Thank you. And also, I just want to offer our help to do the videos in Spanish. And I really would like to, I would like to be invited to the conversation, because what we are doing is just bring the community input, because there are things that culturally are not right and that from schools is hard to see, but that's what we see. We see the gap, and what we are trying to do is to be the bridge. So if I can be invited into that conversation, I would really appreciate it.
I would love it.
We are just meeting to be all in the same board.
Liliana, I'm sorry.
No. Please go ahead, Tammy.
Liliana, we're trying to find the gap. And I realized that I put a story into the chat, into the main chat, of something that happened at the ground level of a family who had no idea what was out, and they were scared. And so we need to reach that. And then looking at our data, and we are at 13% in the school district with Hispanic population. That's a high percent. Yep. And that, I think, a lot of our disconnect is in that. So
yeah, thank you so much for modeling, connecting, making those connections, and making sure that we're not duplicating those efforts. It's happening in one school district, and it's so important that we can support every family out there.
Thank you.
Can I bring in Natasha, Nick, Sue, any deliberation on what got shared or the actions that you think we could take so the focus population can be empowered?
Well, this is Sue. I'm Sue Baugh. I'm on the board of Eastside Pathways, and I'm actually the chair of their board development committee. And I want to tell you, we are actively involved and committed to diversifying the board of Eastside Pathways, because everyone who's on the board is very committed, but we need more representation from these voices that we're hearing. So I just want to tell you that it's not just, we're not just saying it, by God, we're going to do it. So I appreciate this exchange that we just had was so great. I can't believe it. Anyway, just throwing that in there.
Thank you so much.
Thank you all for participating.
Thank you for representing the board and speaking to the fact that Eastside Pathways is intentionally centering around equity. And from the leadership table to every meeting that we have, we are making sure that those that are closest to the results are on every table. So thank you so much. Nick, would you like to speak to what is happening at NISO to bring in the community voice and ensuring that they get served the way that they can feel supported?
Well, I'm not a great speaker.
You can do it.
Yeah.
I know you.
Yeah, I belong behind a computer where no one can see me. That's,
you got that message.
but yeah. Well, with NISO, what we've been trying to focus on has been with getting as accurate and kind of widespread a net of information as possible. We have noticed that with a lot of the people that we've been in contact with, there's been a lot of disinformation out there. And kind of one of the main things that we're trying to work with now is to spread accurate and correct information whilst trying to kind of correct, I guess, any false assumptions. I mean, I don't know if any of you have heard about the rumor that somehow Mexicans are immune to coronavirus.
Wow.
That was spreading around. Kind of weird, but people believed it, particularly a fair amount of members in the Mexican community, which was, it still is kind of problematic. You know, and a lot of other just completely ridiculous rumors out there that have no merit. There are a number of programs out there for funding, for food, that could be very useful to a lot of families. They just don't know the requirements that they either have to meet or that they currently are ineligible for. And that can scare a number of families away from even trying if they're concerned about not being able to meet those requirements. And on top of that, there are also those, unfortunately, that are trying to take advantage of the situation, and basically they open up such programs that are really just scams. Fortunately, they don't seem to get all too much traction, but still, every now and again, you hear about some shady fake organization or some sort of scam email that's going around that's kind of tricking people into giving away their information, thinking that they're going to get actual help, and whilst relying on that help, expecting it to come soon, and they just get nothing in the time they could have spent applying for other services, other programs that really could have helped them.
Absolutely. Thanks for lifting that up, Nick. And you spoke so well. So I wanted to bring your voice in because you are the data person behind NISO. And it's really important that in these times when we have heard that the community is experiencing fear and anxiety, that they might hold on to any information, misinformation as much as good information where they will find help. So thank you for doing what you do as a community-based organization. I would like to invite Natasha here. Any thoughts that you're having, Natasha, as you hear everybody share?
I'm just thinking about, I mean, I'm the fire department, so we're a little bit different. I mean, we're first responders, and we're responding to a very diverse population of people. So, I mean, I guess as I'm thinking about how this applies, it's less necessarily the individuals that we serve in the community that we're trying to listen to, but the community partners that are asking us for help. Like I'm just trying to respond to whatever needs we're hearing, and I'm just trying to say yes and then figure out how we're going to do it after I say yes. I mean, what we're finding is that we're having to step in and fill in a lot of gaps, and we don't work with families and children as much as we do adults. We just don't. We get referrals from fire and police who are out in the community and find people who are vulnerable and need support from social workers, when we mostly work with adults. And right now, what we're finding, the most vulnerable people are older adults who are living alone and have nobody who's checking in on them, and folks who have mental health and behavioral health issues whose anxiety is really starting to go through. So, but there's a lot of organizations that usually are out there that aren't out there right now at all. So, for example, Adult Protective Services isn't doing any investigations. So we make a lot of referrals to APS, and they're calling us back and asking us to go out again and check on people because they're not doing it. So we're having to, fill in the gap, or Hopelik is doing a great job of getting food boxes to people, but they won't deliver to anybody who's COVID positive or who has COVID positive symptoms. So they're calling us and we're delivering those food boxes. So I guess it's a little bit different, but I think that's our way of trying to listen to the community's needs. Is it's really our community partners.
Thank you so much for what you do, and thank you for sharing how you are having to pivot to fill those gaps. Any other?
Natasha, can I ask a question of Natasha? Are you with what fire department? Or
I'm with Bellevue.
Bellevue. So do you work with Charlie, who's with the Bellevue Firefighters
Foundation? The foundation has been really great in supporting our program to fund some things that the city can't fund. So, for example, they will give us gift cards to grocery stores so that we can buy food for people if they need it, or make sure that we have food with us. They've done or bus tickets, things like that. So in that way, we work with them. But and of course, he makes referrals to our program. But as a firefighter.
All right.
Thank you so much. So we will be moved back into the large room in a minute. Is anybody willing to do a quick summary of what we heard? Tammy, is that a yes? We did. I'm extremely excited about the connection that got made and how we are going to be using the resources that are available in one district and make sure that it's available for families across the board. In these times, while boundaries are important, we are trying to work beyond boundaries and ensure that resources are available. So thank you for everything that you do.
Nicholas, you do speak very, very, very well. Could you summarize for us? I was really impressed with how you presented everything. Do you think that maybe you might be able to do that for us?
Go, Nick.
Well, it feels kind of like a bit of a trap here.
I'm so sorry, but you really did. You went right to it.
I mean,
Nick,
I suppose so. If no one else.
Nick, I'd like to also hear that you could use the chat to summarize. Yeah. We don't mean to put you on the spot, but I would completely agree with Tammy. I think you did a great job representing what NISO does and how you're staying in tune with the community. So if you'd like to summarize in the chat, you're welcome to do that.
All right.
Thank you so much for this conversation. We will be back in the large group in a few seconds. I'd like to request you all to take that poll and let us know how things are going on these calls so that we can continuously be looking at what we are doing and how we are serving you. I will see you back in the main room in 20 seconds. I absolutely love this about Zoom. We could stay in this big sphere and then drift away to our smaller groups, and it's been quite the savior. Welcome back, everyone. I hope that you had some good discussions in your breakout. We sure had some rich conversation in ours. Vicky, like I said, before we move into the report out and summary, Vicky will pull up a poll for you all to take. Your feedback is really valuable, so I'd like to request you to spare some time, about 30 seconds. Thank you for your feedback. Just a couple of more seconds and then we can move on to summarizing. I'd like to ask the facilitators, just a couple of you to unmute and share summary from your breakout session. I'd like to request the others to use the chat box to share your summary. Like I said, with the follow-up email, you will get the chat transcript and all the other artifacts that you can refer to. Thank you for taking this poll. Can we please move along to the report out? Kathy, can I invite you to be the first person to unmute yourself and share a highlight summary for us?
Sure. We had a great conversation in our group, and one thing that lifted up that these cross-sector calls where there's multiple different stakeholders, funders, providers, community organizations, all of our organizations were talking about how that they were responding to the need that they were hearing from their community members, that even though they might be doing work in one area, that they really need to pivot to supporting basic needs. We had two members from City of Kirkland, Reggie and Melissa, who lifted up they're going to be pivoting to have a virtual youth summit from their youth council, and really what they're hearing from the youth is really looking for that mental health, physical health, just kind of the isolation, and so they're looking to put together resources for that. And Becky, a pastor from a local church, shared that what she's hearing from her community, and she's going to be having some virtual conversations with community to hear more, really that we're really navigating into more of a place of fear and unknown and low energy, and she's looking forward to hearing more from her community about what their needs are, and then connecting on these calls to ways to serve those needs. Thanks, everyone.
Thank you, Kathy. Can I invite somebody from the Eastside Pathways Backbone team to summarize?
Hey, Sandy, this is Stephanie. I'll jump in here really quickly. We had a really great discussion. Everywhere from the actions that folks can take to discover what the audience needs in order to take ownership includes getting out of the way. You know, just move out of the way and allow people to step into that role, make space for them. Relationships were also discussed. It's really, and I think Helen early on talked about this too, really leaning on those established relationships so that you can hear from people what they really need in order to take that ownership and then take action on what they're saying. Helen also was in my group, and she lifted up continuing to be adaptive, making space again for those voices. And one of the questions that we we're left to ponder that I'll pose to everybody here is, when somebody steps into that leadership role, when community steps into that leadership role, how are you, either in your neighborhood, community, or organization, really going to respond to it, especially if it's something that may or may not completely fit into what you're expecting from them? So how are you going to respond when they step into that ownership role?
That's a great question. Stephanie, can I also request you to put it in the chat?
You
So
bet.
Thank you so much. I would like to invite Tom to share a quick summary from his breakout. Tom, do we have you here?
So, yes, I'm back. I'm just smiling in my mind. My PC died about 5 minutes ago, and so it took me a while to get back to you.
Perfect timing.
Yeah, we had an active conversation in our group, and the one question that sort of surfaced, I guess, is in addition to the 3 to 5 ways that we all know about reaching out to people and trying to connect with them, what are the next things? And the question was, let's ask the whole group. Once you've tried texting and phone calls and email, what else is there? The printed pieces, the multiple languages, all that sort of thing. We're still not getting to everybody.
Excellent. I think that's such a critical question to deliberate on. And Tom, I would like to invite you to put in that question in the chat as well.
I will work it out and get it in there. One thing that certainly came out through the conversation was the fact that there are a number of entities that are very consciously working together to try to reach the populations that they individually serve, and to cross the borders with all that and share that information so that more people can get it. I invite anybody from that small group to chime in here.
All right.
All right.
Thank you for the summary. I think each of you had robust, rich conversations in your breakouts, and I can see some summaries coming up in our chat. I'd now like to hand it over to Stephanie. Somebody's getting a call. I'd like to hand it over to Stephanie to close us out today. Thank you.
Thanks, Sandy, and thanks everyone for joining today and staying online. Thanks to those who participated in the poll as well. That is really, really important to us. As Sandy mentioned, continuous improvement is important not only for our work as a collective, but really, really important for us as a backbone so that we're sure to do better at our job, which is to convene and facilitate this group. So we really appreciate that continued input. I do want to mention that we are committed to offering these convenings through April 23rd, next Thursday. We committed to that back in March of doing these convenings twice a week. Tuesday. And we are considering the possibility of what other convenings we might be able to help facilitate that will support specific areas of work. So it looks like we'll definitely be continuing with at least one of these convenings a week after next week. Next week we'll do the 2, Tuesday and Thursday, and then working with the team to figure out what this looks like for other specific areas of focus. And so stay tuned on more information for that. So in closing, I do, in our style, want to offer the question and invite folks to do just a one-word checkout, unmute yourself. If we can get like 3 or 4 words, people to offer just their thought in terms of this convening to close us out.
Hopeful.
Hopeful. Thank you.
Inspired.
Inspired. Awesome. Thank you.
Collaboration and connections.
Collaboration and connection. Thanks, Jamie.
Youth voices.
Youth voices. One more to round us out.
Eye-opening.
Eye-opening. Awesome. Thank you to everybody. We really appreciate the work that you're doing in the community on behalf of children, youth, and adults in our community who really need it. It is a collective effort. And don't forget that activating yourself, taking action in small ways, that's the key. Do not feel overwhelmed. Take a small step. That's the key to making the change in the community between these calls. We look forward to connecting with you again next Tuesday at 10 a.m. Until then, be well.